Hi, I'm Dr. Jim Geraughty, Chief Medical Officer for Unity Physician Partners. It's a pleasure for me to introduce to you our company, my partners, and the vision that we have for this venture. Several years ago, Mr. Mike Bailey, Mr. Jeff Bogle, and myself came together after many years of success in the healthcare industry. We wanted to address gaps in healthcare and improve healthcare outcomes, and we sought out a partner. Centerstone was a natural partner for us through previous relationships, and also because they take care of a very special population of patients with behavioral health care issues. That patient population lives shorter lives and has increased incidence of physical health problems, and our healthcare system really fails to address that gap. So we created Unity Physician Partners, and in particular Unity Medical Clinics, along with Centerstone, to improve healthcare outcomes, to improve the quality of life that these patients live, and improve the financial outcomes. So it's my pleasure to introduce you to that company and introduce you to our many physicians that are providing those services in our clinics. Tell me, Abba, you joined us in the Clarksville location. What kinds of services do you provide to your patients in that location?
Well, we provide a wide array of primary health care services, including treatment of hypertension, diabetes, hyperlipidemia. We also provide women's health care, and also we provide immunizations, whether it be a yearly flu vaccine or pneumonia vaccine or things of that nature.
How do patients that present with the variety of behavioral health care issues that we see in our clinic, how does that impact their physical health, and in particular, how does that impact how you go about delivering primary health care? And what kind of special needs do these patients have?
Well, these patients definitely have special needs, and things like anxiety and depression can definitely cause physical manifestations, whether it be high blood pressure, stress, other things of that nature. And so this is a special group of patients that definitely benefit from coordinated care between a behavioral health provider, which Centerstone is providing, and also a medical health provider, which presents a unique opportunity for the primary care doctors at Unity Medical Clinic.
Sure, and in that role as you're delivering those services, I assume you communicate with therapists and they communicate with you so that you coordinate your plan of care?
Definitely. We definitely work well with the counselors and the psychiatrists at Centerstone to provide comprehensive coordinated care for these patients who have behavioral health problems as well as medical health problems.
I think of integrated care as an opportunity for patients to get total care and to get all of their needs addressed in one place. And that was what was appealing about this particular opportunity. I've had the chance to work in private practice, in private medical clinics, and in academics and in community health, and so many people find it difficult to actually address mental health issues in primary care. And so this was a unique opportunity to be able to take care of patients, but in a place where I knew they would have good access to mental health care as well.
What types of services do you deliver in the clinic?
Sure. So I provide primary care from basically, we say the cradle to the grave. So from newborns to people who are in their 80s, 90s, and above and beyond. And basically the essential health care. So sick visits, well woman, well male exams, and primary care, well child visits. Also, taking care of chronic and complex medical conditions. So there are quite a few patients who have coexistent mental health issues. So if we've got somebody who has diabetes or coronary artery disease or hypertension, and let's say they have headaches, and I know that they also have depression that's pretty severe, it's not uncommon to contact one of their mental health providers and say, I'd like to start this particular medication for their blood pressure, but I do know that that could have an effect on your regimen for their depression. How should we work together to fix this? So I think that's really at the core of integrated care, is being able to work with a provider who has a significant impact on a patient's overall health because they have an impact on their mental health. And I think that we can address their overall picture a little bit better because we have those resources there with Centerstone.
Sort of a validation of our whole approach, integrated approach.
Right.
What attracted you to Unity?
I found that it was an opportunity to treat patients the way I've always wanted to treat patients, and not focus on just an illness or health maintenance, but actually looking at the entire patient, using everything that family physicians usually have in their armamentarium, with the addition of behavioral health on board. So that excited me. I've always been very interested in the behavioral health side of medicine. Well, I just saw a new patient to Unity, a 45-year-old woman who's lived here for a long time, but was born in another country, and English is not her first language. And she's been struggling to work as a manicurist, and she's no longer able to do that because of physical as well as mental health concerns. She has a primary care provider, but has decided to switch to Unity because she felt that, in her words, he never listened to my story. And I heard that phrase, and it really touched me, because I think that's where everything sort of lies, is in the patient's own story. And at Unity, we're all about the story. Mm-hmm. Her story is the whole reason why she has hepatitis B and now has GI complaints and is unable to get in to see the right specialist. Her story is the reason why she suffers from depression and why Centerstone is also involved in her care. I can go right down the hallway and find a therapist and a psychiatrist who will say, yes, we'll put her right in. And if you know, she can't afford it, well, then we have a safety net program. I didn't feel like I was handing the patient off. I felt like we were joining hands. I think that Unity has made holistic healthcare their mission. I don't see anything else out there on the landscape like it.
Today you've seen an example, multiple examples, of the passion, the energy, the professionalism that our team is bringing to the delivery of healthcare services to Centerstone clients and to clients and patients that live in our communities that we serve. I look forward to bringing you additional success stories as time moves on. But we've got a great start. We're delivering fantastic services to patients that have not received those services in the past, and we're getting great outcomes.